Hi everyone, welcome to this informal sharing with our third year nursing student Paula. We have heard from our APN. Hi Paula there, I'm Siriwan. Yeah, we have heard from our APN teaching the last 2 weeks about the oncology topics, and we have heard about various kind of cancers, the investigations, and the treatments, as well as the medical and nursing care for patients, oncology patients. What is really more important for us as nurses is to learn how to connect and support patients and also their families, especially caregivers, through this tough journey. Yeah, and we are very privileged because our very own third year nursing student Paula Nazarene has actually gone through this journey caring for her dad, who was diagnosed with NPC in 2018, right? And yeah, so Paula has very kindly agreed to share her journey and her experience with us. So without much further ado, I'd like to introduce Paula. She has, throughout all this difficult time, Paula has been very positive and very uh, holding the family together very well, supporting the father and her siblings and her mom, being a nurse herself, being a student nurse herself, with all the knowledge that she has and whatever she have learned from the school, she have applied it. So we want to hear from Paula. Paula, how is it like being a caregiver to your dad? But before we start, maybe you want to take some time to share with us a little bit about yourself, your dad, and also your family.
Okay, thank you, Dr. Siriwan. Hi, everyone. I'm Paula. So today, the Miss Laifan and Dr. Siriwan actually asked me to share about my journey with my dad, with special emphasis on how nurses can help our patients tide through those times, especially for cancer. So sharing a little bit more about myself, I'm in year 3 this year, 2020. My dad was diagnosed with NPC in 2018 when I was just 19 years old. That was when I was waiting for my A-level result. So I wasn't actually January 2018. So I wasn't actually a nursing student yet when he was diagnosed. Everything was new to me. But I didn't go into nursing because of that. That's another story for another day. But I ended up in nursing, and I can say it's been a very fruitful journey since what my dad really needed was the nursing care. So yeah, so what happened was he was diagnosed in January 2018. Then we thought, the treatment was going well and everything was going well. But from I think late 2018 to 2019, the scan showed that the cancer has metastasized to different organs. So from then on, of course, the treatment is trying to prolong as much as we can. But the good thing is my dad didn't actually lose hair, lose weight, lose his energy and all that kind of thing. So it was quite manageable for my family and I, and we played different parts. So for example, for mine will be the nursing medical side. For my mom, she'll really like lead us in prayer and all. My sister and my brother mostly very supportive. So for example, they would like play the guitar and sing songs. Sometimes we'll just jam at home and all that. Yeah. Um, he passed on just around 2 months ago on the 11th of September, 2020. And since then, I mean, now it's only October. Since then, we've been doing our best and we've been coping relatively well, I would say, with the help of everybody around us. Yeah. So I'm excited to
Wow.
share my journey.
Must have been really difficult for you, Paula, because juggling schoolwork and also caring for your dad. Yeah, so sorry to hear about his passing, but I'm sure he's very proud of all of you looking down from heaven. Yeah.
I think he is.
So, in order to help our nursing students better understand your journey, Paula, as a caregiver for your dad, would you mind to bring us back to the very beginning when your dad and your family first received the diagnosis? How did your family, process through the news and come to acceptance of that news?
Mm. Okay, so we did not know that there's any history of cancer in my family, in my dad's side especially. My mom's side also. So and we didn't know anybody who actually had cancer, like close friends and relatives. No, we didn't know anybody. So when we first received the diagnosis, and his only symptom was nose bleeding. So his cancer was nasopharyngeal cancer. That's at the back of the nose. The only one was nose bleeding. That's all. And maybe when he coughs out, sometimes there's blood. So and being not having anybody in the medical field, it was all very new to us. I especially remember telling my friends, because I'm very close to my JC friends. I remember telling them that this feels so surreal. It feels like we are in a movie, or we are in a drama, so to say, because um that's the only time that I saw people who are dealing with cancer. But the doctor actually, at that point of time, they said he was diagnosed stage 2 NPC, and NPC is one of the most curable cancers there is. So he said not to worry, and he's quite confident that the primary tumor will be able to be treated with chemotherapy and radiotherapy. And it was. So the primary tumors were cleared in his nasopharynx and his cervical lymph nodes. But yeah, so for my dad and my mom especially, I think my mom was the one who was kind of hit the most. I mean, having they were only 50. My mom was 48, I think. Then my dad was 55. So it's a very young age to know that your husband your soulmate may be leaving you soon. Like when you hear cancer, it's such a loaded term, especially if you're not in the field. It's like cancer, oh, you're gonna die, that kind of thing. So it was very difficult to process at the start. My siblings were asking me, because they knew I wanted to be a doctor initially, so my siblings were asking me, how long would he live and all that kind of things. But um throughout all those, I think what was important was we were very supported by the church, by the family around us. And yeah.
So sometimes, being a nurse when you're graduated, what kind of, how do you feel that the role the nurses can play, when patient receive the news that, they have cancer? Sometimes we wanted to comfort the patient, but there are also times where we are not sure how to go about doing it because maybe patient themselves are not yet able to accept the diagnosis. So maybe you can share a little bit about how our nurses can bridge the gap between, you know, still being a professional in your practice and yet able to reach out to the family to comfort them.
Mm. Maybe I would like to I'll share my experience first, or my dad's experience rather. At that point of time, I was working at a clinic. So I asked the doctor, as in a specialist clinic, private specialist. I asked the doctor, do you know anyone who specializes in this kind of cancer, blah blah. So I found an oncologist for him, and um, getting being there on the first few weeks, it's very, I would say, like the doctor's office and everything. It's very intimidating. It feels like, especially my dad, he has this thing, he's like white coat syndrome. So when he sits down in doctor's office, he like he acts like the best patient and all that kind of thing. And I think, I mean, of course, doctors and any healthcare professional actually has um that authority, so to say. So it's very, yeah, I remember it as being very intimidating at the start. What helped actually was when he was starting to get chemotherapy already. And chemotherapy is, I mean, the drugs are given by the nurses, they're the ones who are gonna poke you and stuff like that. So I think it's very important. I think nurses' superpowers is observation. So that's what we are good at, and that's what we should always be doing. So it's very important to see the body language, talk to the patient. Of course, there are patients who definitely may not want to talk to you, but as nurses, it is your job, it is your responsibility actually to care. So I always say, I heard this phrase and I always tell anybody, nurses care, doctors cure. So you have to complement the curing, the treatment that the doctors are doing with the care that you want to show the patient. So how can you do that? For my dad, he's a very jolly person. So I think I would like to think, and the nurses also told me that actually your dad taught us to be more relaxed, because sometimes he would walk in, then the nurses will be like, "Hey, Kuya Pogi." Kuya Pogi means like handsome brother in Tagalog. Yeah.
I
Hey,
see.
Kuya Pogi, then they'll be so happy seeing him, because in the midst of how like busy it is and everything, my dad would cheer them up. And sometimes not all your patients are as cheery as my dad, as much as we want them to. But what nurses can do would be a simple smile, build rapport. Hi, how are you? Don't be afraid to ask questions, because
Right.
you don't know how open your patients can be. Sometimes they don't know how to take that first step.
Yeah.
So you have to talk to them and just, hi, how's your day? How are you today? Then they'll just, this question, hi, how are you? Then people will just say, it's okay, I'm okay.
Yeah.
Then you can ask, I think you can ask, how are you really?
Yeah. Yeah.
I think it's very important to do that.
To
Yeah.
break the ice.
Yes, correct. Breaking the ice,
So,
especially at the diagnosis part. Yeah.
yeah, from what I can hear about your dad, Paula, is basically he is also a very jovial person. Sometimes we have this idea that, well, once cancer patient hear the diagnosis, they'll be super depressed. But there are also the need to use humor and the need to bring in some cheers for them as well, especially at the early stage when they are trying to come into, acceptance of what is really happening to them with the diagnosis.
Mm,
Yeah. And to also, tell them that life will still go on despite this diagnosis. And it's also very heartening to know that, the families are, for your family, is like everybody have their own role. Like you were saying, you will
mm,
get all the information. You even find the oncologist for your dad,
mm, mm,
right? And then your mom will be like the prayer warrior, and your siblings bring in the cheers, right? So
mm.
the other thing you mentioned about the observation of nurses as well is like it's very important to understand the dynamic of the family and
Correct.
how to tap into this dynamic to be
Mm.
able to bring the family together and to support the patient. Yeah, and not to
Yeah,
be
correct.
afraid, like what you mentioned, not to be afraid to ask, "How are you today?" and just
Mm.
bringing smile to them just through your own happy disposition as well when you are nursing them, right? Yeah.
Correct.
Thank you
Correct.
so much just for
Mm.
sharing. I think you have some pictures about your dad.
Yes, I do
You like to
actually.
share some
Let
pictures
me
with
see
us?
if I can share
Yeah,
screen.
okay.
Okay. Okay, this one is a video of
Uh,
how so he actually makes boomerang of like
uh,
his phlebotomy experience. So his
right.
nurses or
A
the
lot of blood
phlebotomist
taking,
will take,
right, during this stage. A lot of
yes, a lot of blood
investigation.
taking.
Yeah.
And sometimes
So
the phlebotomist will be like very happy to see him because they know he's the one who always takes photos. And at first they were like, "Uncle, why are you taking photos?" that kind of thing. But
right.
they understood, because having gone through 3 years with him, they understood. I have some more
I
photos.
feel painful watching the boomerang. Ouch, ouch, ouch. The needle keep going in and out. Oh dear. But your dad is so he look at the brighter side of the situation, right?
He
Yeah.
does, he does. So like for example, this photo, it's like an ultrasound scan,
Mm.
and he can still like, thumbs up and take photo. I wonder if
Oh,
the
and he
technician
sent
is
to
there.
y'all. He shared with the family.
Yes, yes. So
Oh, okay.
whenever we go for scans, treatments,
Mm.
chemo, and all
Mm.
these kind of things, he would send
Mm.
it to our chat group. This
Right,
is
right,
him in one of his chemo sessions. He would like take a selfie and
yeah,
then send to us.
right.
Yeah.
Yeah, talking about that, Paula, you know,
Mm.
yeah, your dad is such a jovial person. What
He's
is
such
he
a
doing to your
joker.
sister here? Your sister is
So my
sleeping.
sister fell asleep, yeah. Because usually it's blood test, then you have to wait 2 hours before the
Okay,
chemotherapy itself.
right, right.
So she fell asleep and then he would like just take funny
Oh,
photos. Yeah.
okay. It's like family bonding time when you're, join your dad for his investigation, blood investigation, doctor's appointment, and chemo as well.
Mm-mm. Okay.
Paula, thanks for
Mm.
sharing the initial part when you all heard about the diagnosis and you all, you know, you know, look at the brighter side of the situation. But what is it like when your dad is going through the treatment? Certainly, we heard so much about the side effects from the treatment, the chemotherapy, the radiotherapy, and all that. Can you share
Mm.
something about how did your family cope when your dad has to go through so many rounds of blood investigation, chemotherapy? What was it like for your
Mm.
family during this point? What helps? What are the things that nurses do that helps?
Mm. Okay, so for his treatment, um like what I said, so for what are the things that nurses can do to help?
Mm,
I think I mean different patients are different. You know, some people who get diagnosed in later stages, especially end stages, when they're just
mm,
going through palliative, maybe you'll see them only for a while, a few weeks, a few months, that kind of thing.
mm,
So it's very important to make them feel secure in that
mm,
environment.
mm,
That's what I would say, because at home they are already very tired. They have all those worries and all that, those things to think about. So what my dad's nurses would do is, you know, while they are injecting, while they're preparing the drugs, they would prepare it near him so that they can be talking, because he's a very talkative person.
mm, mm.
And just what nurses can do is really to ride on what they are talking about. Sometimes it's very important to them,
Mm,
and to make them feel that somebody's still listening to them. I mean,
right.
even if they're at the clinic, because I think um sometimes the clinic or the hospital can seem like a very foreign place. You know,
Mm,
like to them, they just go there for treatment, they sit down for a few hours and it's done. But
mm,
actually the hospital, the clinic can be a place to touch lives, to change
mm,
lives.
mm.
And that's really what the nurses managed to do for my dad, and vice versa as well. My dad also managed to do that for the nurses there. So
Is there
that's
any
very important.
moment, Paula? Is there any moment whereby you feel like the nurses care about you as a caregiver?
Yes, so they would, because since I've been going with him for 2.5 years, sometimes maybe when it's exam season and then my brother would happen to have school vacation, my brother would go with my dad instead weekly, and they wouldn't see me for a while. They wouldn't see me
Mm,
for maybe a few weeks, maybe three weeks or so.
mm,
Then when I come back, then they'll ask me, "Hey, how are you? You know, how's things?"
mm,
Especially, maybe I'll talk about this towards the end, because towards the end, that's when I really felt the care that they, you know, they check on me. They took my
right.
number down, and they asked me how the family is, how my dad, how I am. Yeah, amidst all this, because they know I'm still studying as well. So maybe what I would like to say is leverage on the caregivers. So
Mm,
for the nurses, when you become a nurse in, I mean, I'm talking to the audience, Dr. Siriwan. Yeah,
yeah,
when they become a nurse in the future, leverage on the caregivers, because
yeah,
sometimes, you know, the caregivers may be a little more level-headed. They are a bit
mm,
more they have a maybe a clearer mind.
mm,
So you can ask them what's the dynamics at home,
mm,
how how the patient is coping at home, how the family is coping at home, so that as a
mm,
nurse, you know your position and you know how
mm.
best to help your patient later on.
And how to connect with the patient, right? Yeah,
Correct,
right.
correct.
Those little information that makes a difference in the way you support the patient. Even
Mm,
words and touch that is at the right time means a lot to the patient. Yeah.
mm, mm,
I'm just wondering, Paula, because you're the main caregiver, being the nurse, the nursing student in the family, when patients are going through the chemo, there's they are very easily tired.
Right.
And how is it like at home? Because they will need to depend on you a lot more. So how did you cope as caregiver? And yeah, how can the nurses in the hospital prepare you better in this sense, like how to manage the side effects from the chemo and all that? And share a bit about your experience as a caregiver for your dad.
Yeah. So maybe what I'm not sure because my dad, we sought treatment from a private hospital. So I'm not sure if there's a difference between, because sometimes in let me be very tactful about this. Sometimes in private hospitals, some of the patients actually don't really want to talk to you, and that's understandable. So sometimes maybe the nurses didn't really know how to approach, um but maybe it's like the nurse's character also. Maybe they really didn't know how to approach. But um what I would say is to always spontaneously educate your patient. Don't wait
Mm,
for the patient and the caregivers to ask questions, because for us, we didn't really receive a lot of patient education from the nurses. It's more of when we're sitting with a doctor, and it's not really an education. It's more like, this is gonna happen. You're gonna feel tired. You're gonna have
mm.
dry mouth, blah blah blah. But
Like being very factual about it.
correct,
Yeah,
correct. There's
and
not much like advice or suggestion. And sometimes, like what I said, the patients and family members at that point of time in the doctor's office or in the hospital, they may not know what to ask. But you
mm,
as a nurse, you know all the knowledge, you know all the wisdom.
mm,
We as nurses should be able to spontaneously be more forthcoming, spontaneously talk about all this with them and educate them. So, and I think what I would like to touch on would be cancer fatigue. So
mm.
it's a very different kind of tiredness than what normal you think after an 8-hour shift without lunch, without without sitting down and everything is tiring. But it's a very different kind of tired for cancer patients, and
Mm,
that's what I saw with my dad. So I mentioned earlier that he didn't really lose weight, didn't lose his
mm,
hair. He wasn't very tired, but there were still moments, especially right after his chemo sessions, where he would be so tired.
mm,
And I guess it's because I've been with him for that 2.5 years, right? To me, sometimes I would dismiss his tiredness
mm,
as, maybe I was like, maybe he's just being lazy, Like for
mm.
example, one story would be the remote is quite nearby already, the TV remote, and then he'd still ask me to like take it for him, even though I'm sitting much further away.
Yeah,
Those
yeah, yeah.
little things,
Right, right.
or things
Yeah,
like getting him a cup of water. Because growing up, they always instilled to us that if you can do it yourself, do it yourself.
yeah, right, right, right. Yeah.
And
Kali, you mentioned earlier, Paula, that because your dad didn't lose hair, he didn't lose
mm,
much weight. So the
mm,
assumption that you look perfectly fine, why are you asking me to do this for you? It
correct.
it's quite how it says natural when people look at someone, even for nurses, we look at the
Mm,
patient. You can do it yourself. Why are you asking me? I'm so busy. Like what you
exactly.
mentioned, I hardly go for my lunch or my break, and now you're just asking me to get a cup of water. It's just next to you, right? So
Yeah.
we have this perception that they should be able to help themselves, right?
Mm, mm,
But we are talking about cancer fatigue. Maybe you can describe a bit more so they can understand better.
So, I mean, I did not experience it myself, but my dad was very vocal about his experience to us. So
Mm,
he would
mm,
share with us that he would feel like his body mentally and physically just cannot move.
mm,
So there's a there's a Tagalog phrase for it, but there's no
right.
direct English translation as far as I know. He said his hapong hapo, which means that it's like from the inside, you just
Mm,
really have no energy to do
right.
anything. You're just very, 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 the word is not tired, it's not fatigued, it's not enough to describe. So I would think that um we sometimes he would even, one thing that he did to combat that. For example, when he's very, very tired after chemo or radiotherapy, but he'll have dry mouth at night. So um he actually has a spray bottle so that he doesn't have to wake up my mom in the middle of the night, so that he can ask her to get water. So that's how tired he is. He can't even pick up the glass of water from the side of the table. He would rather have a spray bottle to spray. Yep. Yeah. You're muted, Dr. Siriwan.
Sorry, I'm muted. Sorry. Right, right. So sorry. Yeah. What I can see is that, you know, the thing about caring for oncology patient is the importance of empathy, Paula.
Mm,
Like
mm,
sometimes we have to put ourselves in the patient's shoes in order to understand where they are coming from, so that we don't feel um, like we are judging them, because we are
mm,
fine. Even though we work for 8 hours, we are tired. Imagine that kind of tiredness. On top of that is still your body coping with the treatment, the side
mm,
effects, and all
mm,
the disease process itself that can really drain you, where you lost your
mm,
appetite, you lost your, you know, your nutritional intake is compromised and all that.
mm.
Yeah.
And he
So
was working on top of this.
oh wow, he's still working full
Mm.
time. Yeah.
Yes, he was working full time.
Can you share a little bit about your dad in terms of him being the, you know, the main breadwinner for your family? I know your mom works, but he's the man of the house. What
Mm,
kind of worries your father have that you can see that, you know,
mm. So,
in retrospect?
yeah, so my dad is a very family person. He, despite all the, I prepared some tissue just in case. Yeah, despite all the things that he was experiencing at that point of time, the fatigue, the when he was going through radiotherapy, he had, you know, those RT burns that they call. That's what APN Chiching was talking about, RT burns. Um, dry mouth, mouth ulcers. He couldn't eat well, couldn't talk well, couldn't swallow, and all that things. So it's he still chose to work because he was very worried for our future. I mean, we came from the Philippines. We are not, we really that's why we came to Singapore, because we are poor in the Philippines, right? We tried to, my dad really tried to find a better life for us here. And um I feel a lot of, like, even though I was a nursing student, there's actually a lot of guilt, I would say. Even though I gave my all for my nursing skills, like I helped him do wound dressing, subcutaneous injections, and all these kind of things. But there are still moments where um it's still very difficult to process. So for example, there was one time where he told me that um like when it mets everywhere already, right? And then the tumor in his liver was like near, there's a lot of blood vessels and stuff. So surgery wasn't an option. Other treatments were an option. He told me, hey, can you try to find like other treatment options for me? And um I mean, in being in the field, I knew that there weren't any other options already. So I kind of dismissed that request that he had. Instead of finding for him, I just said that, but I just very dismissively said that, oh, cannot already, because, you know, the tumor's too big, it's near your blood vessels, thinking that he would understand and just leave it. So I still feel a sense of guilt. And then thinking back, like, I mean, there's a lot of guilt even at that point of time. But also thinking back, I knew that he wanted to get healed, he wanted to get better, because he wanted to provide for the family. He still he still wanted to be with us. Even you're muted again, Dr. Surya.
Yeah, I think yeah, it's hard. I mean, being a mother myself, and you want to hang on there to see your family. It's
Correct, correct.
natural. Yeah.
Mm-mm. So he's a very family person. And
Mm.
I think as nurses, if you choose to go through like go to oncology specialty or whatever disease it is, our
Mm.
patients, especially if they're only middle-aged people, they
Mm.
really they want to see a lot more things.
Right. They want to have hope, right, Paula?
Correct,
They
correct.
want to have hope that there are alternative treatment,
Mm-mm-mm.
right? Because being in the healthcare, like what you mentioned, you're very logical, you're
Mm.
like very evidence-based.
Mm-mm.
And sometimes you talk about guilt, it's like you feel like you could have uh, comfort your dad differently, but maybe you want to
Correct.
share a little bit more like how can nurses be more sensitive to our patient?
Mm. Mm. So there are different ways. Some that I would Okay, so for one thing is about the pain, for example. My dad's cancer, some of it mets to the peritoneum. And um then he would always complain of abdominal pain. But it's
Mm.
very, because I mean we don't know, it's everywhere, right? And like stomach tumors in the on the peritoneum. So um the nurses wouldn't really understand, like they some of them they didn't understand that the pain was very real. I think as nurses sometimes we also tend to just dismiss patients' pain. If you see them, oh, their heart rate is okay, their blood
Mm.
pressure is okay, that means there must be no pain, and that means they must be like just lying, like sort of like lying, so that you
Mm.
can pour the water for them because they are lazy and things like that. But one thing is, let's give them the benefit of the doubt. I mean,
Mm.
you are working as a nurse,
Mm.
the patient comes to you for treatment, for care.
Mm.
The patient didn't come to you for you to judge them. And if the patient is lying, that you didn't lose anything. You still help the patient. But if
Mm.
he's not lying and you help the patient, you made a difference to their life,
Mm.
because at that point of time when they are so vulnerable, when they are so weak, you
Mm.
were there to help them.
Right.
So that's one thing. The other thing is being tactful when it comes
Mm.
to those kind of things. I mean, I know, of course, treatment options and all these kind of things, it's supposed to be a doctor discussing with them. But like what I
Mm.
said, sometimes the patients may not be fully present. Their mind might not be fully present when talking to the doctor. It's like, oh, yeah, the doctor is
Mm.
here. I'm scared, that kind of thing.
They tend to go to the nurses more often,
Correct,
right?
correct.
It's like when
Then
the
you
doctor
ask
comes, they
me.
suddenly, yes, yes, yes. But later on, you say, nurse, can you explain further? What did the doctor
Correct,
actually say to me, right?
correct, correct. So in that sense, tactlessness is very important.
Tactfulness,
Um,
you mean?
yeah,
Be
tactfulness.
tactful.
Thankfulness. So it's very important to observe body language, and again ask the caregivers, ask them what they feel first. So what I do with my dad is, after what we do is, after each scan, the doctor will
Mm.
explain. Inside the doctor's office, I would still translate to him in layman's term and in Tagalog,
Mm.
so that he
Mm.
fully understands during that time. But again, even with that, he would like forget, or he will misunderstand things. So I sit my family down
Right.
at home after the
Mm.
scan, then I'll
Mm.
explain to them.
Mm.
But what I do with my dad is, I ask them what they understand first. I think
Mm.
that's very important. You
Right.
ask them, what did you understand from the doctor, and then ask
You
them how
assess
you
first.
feel
You
about
assess
it.
their knowledge
Correct,
level
correct,
first. That's what you learn, right? Before you give patient
correct.
education, you always assess what do they know first. Yeah.
Correct, correct. So we think this APIE thing is like very it's like sometimes we just think it's so like, why are we doing care plans and all these kind of things? But actually it's very important. To me it's very
Mm.
important. Sometimes,
Mm.
like now, I didn't even realize that I was doing it. But
Mm.
that's the way to go. You have to assess the patient's
Right.
understanding and emotions. I think emotions is
Mm.
very important.
Mm.
Then
Right.
you can give your comments or education. Yeah.
During this period, while your dad is, like he knows that the cancer has spread, like what you mentioned just now, and he's looking for hope, looking for alternative treatment. And you, as a healthcare professional, try to be very logical with him and to rationalize with him so that he'll be realistic, right?
Mm.
But on the other hand, I know when you talk about guilt, it's like you don't want to take away the hope from the patient. On one hand, you don't want to give them false hope, but on the other hand, you also don't want to take away hope from them, right? So this is definitely not an easy situation to be in, right? So moving forward is like, yeah, how can nurses not take away the hope and yet at the same time don't give the patient false hope?
I think this one does come with experience. At the start, I didn't, even when I started being a nursing student, I didn't just at a click, at a snap of a finger, I knew how to talk to my dad. No, I think it comes with experience with different patients that you meet. And I mean, I was working at a clinic for 8 months also, so the conversation with your patient is very important. So
Right.
that's number one. Make use of different patients experiences. Talk to them so that next time you know how to deal with other patients.
I
Second,
totally agree.
I think Dr. Siriwan, with all your experience, you would know that it comes with experience, this kind of
It
thing.
does, it does. I also realized that, Paula, with your family, you're also warm and open and embracing. I think if any nurse that nurse your father will find it easy to build rapport with your father. But then on the other hand, the other spectrum is those who are very reserved and very private and very quiet. But sometimes we thought that, oh, they are managing because they are not asking questions,
Correct.
they are quiet, they should be fine. But actually, maybe these are the group of people that deep down they are feeling so much and yet
Correct.
they're not able to bring it out. So I think as nurses, you are right. We got to be observant, we got to be mindful. Like, if those who can express themselves great, it's much easier to bridge the gap. But those who are more quiet, it's like, should we be more proactive and more forthcoming so that we can draw out from them what are their fears, what are their anxiety and concerns, so that we can address it. Yeah, so definitely that's the beauty of nursing, right, Paula?
Correct.
It's
Correct.
like
Correct.
it's like you can do so much and you can impact people so much, but it needs you to really develop that empathy, develop that observational abilities, and applying your APIE definitely. Right. Yeah.
And
Anyway, thank you so
just don't
much
be
for just,
afraid.
yeah, yeah. I think your dad has some memories that he create with the family.
Yes.
You want to
Yes.
share some pictures about,
Yes, I
I mean,
do.
they realize that time is limited and they try to make the most of their time.
So like, for example, this one. This
Ah,
is in July 2019, where I mean he had symptoms like all throughout the 2.5 years. He was tired, dry mouth, and all this. But this was their silver anniversary, 25th wedding anniversary. So my dad really made an effort to brave his symptoms, even though he got stomach pain and all these kind of things. He booked a chalet for us. And we just literally just chilled at the chalet. We didn't, because
wow.
we are very at least my family, all of us are very homebodies. Like we didn't as okay, but my dad loved going out. He loved to jalan-jalan.
I can see your dad is a very fun person, Paula.
He is. I think he
Yeah.
suggested this post. He
Yeah, and
suggested
all of
this.
you got his smiles. He's that
Yeah,
happy, kind of cheeky smiles.
yeah. You see, like there's another post like this. This is me being like angsty in one of our chemo sessions. Because I think you
Right.
see, I'm holding my
I can
planner.
see you're very stressed out, Paula. You're more
I was very,
stressed.
I was very stressed. Then he just
Yeah.
like that, and then he just took a
Right,
photo to send to my
right, right.
parents, to my family.
It
This
seems like
one
he
was
encouraged you. He's encouraging you actually.
yes, yes. So even you see, he was wearing his uniform.
Yeah.
So after the chemo, he would go to his work, but he's
Mm.
very tired, but he will still go to work, and then he'll still be the one encouraging me, like, it's okay, just take it step by step, that kind of thing.
There's one more photo. Your dad going through the chemo. Can you go up there?
Going
There's one.
through the
Okay,
chemo.
below your father post there.
This one,
Uh oh
this
yeah, yeah, with all the yeah, that one,
this
that one.
one,
Yeah.
this one. Okay, this
Can you
one
see
was
behind it? He got so many drips, Paula.
correct, correct. Yeah,
Wow.
this was his last hospitalization actually, where my
Okay.
so we video called some relatives in the Philippines, and they were praying for my dad.
Right,
And I
right.
just wanted to capture some memories,
Yeah,
my mom
yeah.
my mom was so is so supportive. That's my
Right, right.
sister.
Yeah, so your mom is praying, your sister is massaging your mom. I can see that there's a lot of
My sister was like laying her hands on
laying her hands. Wow, can see the
yeah.
unity and the love, and I think that's what helps your dad the most through
Mm,
this difficult time. Yeah.
correct.
Okay, there's one more just above your family post at the
Just
chalet.
above this
Yeah,
one.
that's the one. Yeah.
Yes. Okay,
Wow.
this
Can you
one
see? I
is
can see the porter cat. Is that a porter cat?
yes, that's a photocap.
Yeah.
Yeah. So
Wow.
it's
Is
very
that
interesting to learn about it now after
right?
having
Right.
it.
Wow. But can see that's so cheerful, and you're
He
right. He
is.
still have a lot of hair, and he still looks good. Like he didn't lose much weight, right?
Correct, correct. So
That's why it's harder
why
to understand cancer fatigue when you see your dad so well.
exactly,
Yeah.
exactly. He's so forthcoming. So I took these photos because usually I would post on my Instagram to share like the nursing journey, follow
Right.
nurses. Okay, yeah. So but before I made this account, actually, I was just sharing it on my personal account just to show people that cancer doesn't have to be such a scary taboo thing to go
Mm,
through. So I
mm,
I took like when I was doing his SC injections. I remember the
mm.
first I haven't actually learned SC injection the first time that he needed this, but
Okay.
my aunt who is actually a midwife, she happened to be in Singapore that time for a vacation.
Oh,
So she
okay.
taught me how to do the injections.
Oh,
And
even
then
before you learn sub-Q.
yes, correct. So the very first time I didn't know how to handle and stuff, right? So the needle actually twisted inside.
Oh no!
And
Wow.
then, because I think I left it, yeah, I left it hanging.
Oh
And I was just like,
no.
oh, sorry, sorry. He was like, ah, yeah, he was just okay. But at least the needle is just very tiny, right?
Ah, okay, okay. Well, he's
Then
so
this one
brave.
was
He
doing
had trusted
dressing.
you totally, Paula, to do it.
Yeah, yeah. So he like like for example, he would have what did he do? Bone marrow aspiration.
Oh,
He
wow. That's
actually asked the
painful.
doctors if I could watch because we haven't
Mm.
learned it at that time, but the doctor said cannot lah. But he would always find opportunities for me to to practice my skills. So he allowed me to touch his photocard and all that. Yeah. This actually um this is the dressing that we got from school that I haven't opened yet. So this was the
Oh,
first
okay.
time I used it.
Okay, it's sterile. You make sure it's
It's
sterile.
sterile. It was sterile. It was sterile. Yeah, this was the first time
Okay.
he got photocard. Yeah.
Ah, okay. Well,
Still got the wound there. Oh,
you
yeah.
have a handsome dad, Paula.
That's what all the nurses say. That's why they call him.
Now I
That's
know
why
why
they
they
call
call
him
him
cute for it.
handsome brother.
Correct. Thank you, Dr. Siriwan. Yeah.
He got very,
Then
very beautiful smile.
yeah, yeah. He would always like, and then one of the sister in his clinic, sister was like, "Your dad showed me a photo of him when he was working in Korea. He looked like an oppa." Because he worked in Korea for 4 years before he went to Singapore.
Ah, I
He had,
see.
those like K-pop hairstyle
Wow.
in 1990 or something. Yeah,
Yeah.
I think it's very important to build this kind of rapport with your patients, lah.
Yes, yes,
Mm.
that's right. Yeah. Okay,
They
there's one more
banter and
picture.
things.
Right below when your dad is at the beach. Is that at the beach there? When another
Yes,
memory. Yeah,
yes.
you have to share a little bit about this family gathering.
Yeah, so we went back to the Philippines in December 2019. I
Okay.
tried to be tactful with how like because we haven't gone back for 3 years, I think.
Hmm.
Then I was like, but I know that his condition wasn't looking very good
Right.
in 2019. It
Who
mets everywhere
initiated this
already.
trip, Paula? Who
It was
initiated this
me.
trip?
It was me. Yeah.
You initiate.
I actually
Wow,
told
that is so
him.
lovely. Is this the
Yeah.
hometown? Your dad's hometown?
No, no. Actually, we are just based in Manila, but we visited one of our relatives here
Oh,
further up
okay.
north. So
Right.
like their house was near a beach.
Okay.
Yeah. So I initiated this in May 2019 to go back in December 2019.
Wow.
So
Wow.
I thought that that I worded it well. I was like, I think it's good to see your relatives and all that kind of
Hmm.
thing and to visit our hometown and blah blah blah.
Right.
Then when he came back, he just came back, right? Then he was telling his nurses, oh, yeah, my daughter forced me to go home because she said that it might be my last one. I
Oh
was like,
no.
that's not what I said.
Okay.
But
I
his
think at the
nurses,
back of his mind, like patient who have this diagnosis, somehow they know that their time is limited. One thing for
exactly.
sure, none of us is going to leave this earth alive, that's for sure.
Correct.
But for cancer patient, it's that all the more they're aware that their time is limited and they want to make the most out of their time. And I think you did the most beautiful thing, Paula, is to, organize this trip before COVID-19 comes this year,
Right.
right?
When we
So at
came
least you
back,
got chance to go back
travel
Philippines,
restrictions.
his homeland, right?
Correct.
It's a
Correct.
closure
Yeah.
for your dad, don't you think so?
Mm-mm.
It's like, yeah,
He
wow, so
really, really
beautiful.
enjoyed it. He really
Yeah, I
enjoyed
can
it.
see
We
that.
went out of town 2 times during this 2-week trip. Yeah.
Wow. He still looks
And
good there,
yeah, he does. He does. The side effect at this point of time of his combination of drugs was blisters on the feet. So
Wow.
yeah, and swelling, peripheral edema. So that's why he was wearing all sorts of things. And but he braved it all. I think it's also to give us the time to spend with the family and make memories with him. Yeah, so we really appreciated that. Mm.
I'm so touched.
Thank you.
Yeah, I mean, for your dad to make sure that he stays strong for the family, right?
Yeah, yeah.
Right. Okay. So I better not be emotional here.
Dr. Siriwan, we are not at the emotional part yet.
Because I'm a mother myself. It's like I can imagine, like, you want the family to enjoy their time. You don't want the family to focus on your suffering, right? Even though he got blister, he's feeling a lot of discomfort, a lot of side effects, but he braved it all. But your family is great. Everybody's happy in that picture.
Mm.
Yeah. So that's like the chemo. He's going through the chemotherapy, radiotherapy. There's a lot of side effects, and the family have to, come together, band together, be united in prayers, in supporting him in any way, accompanying him and all that, and create memories, right? And I think it's so beautiful to, yeah, to do it together as a family.
Mm.
How did you all prepare your dad for the last journey then, Paula? I know that it's great that you're enjoying the moment while he's still looking well, doing fine. But what about the last part when the end is near? How
Mm.
how was your dad? Is he ready? Is he aware? How
Mm.
was he? How prepared is he?
Okay, so I mean, like what you said just now, I think at the back of every cancer patient's mind, you know that you have an expiry date, so to say, like it's looming. Some patients prefer to know the prognosis right away, so they would ask the doctor how many months, how many weeks, that kind of thing. Some doctors spontaneously say. For my dad and the doctor, my dad never ever asked for his prognosis, which surprised me actually, because like
He never
I
asked
got
at all.
he never asked at all. I got my confrontational nature from him. So I thought that he would be in this sickness, right? He would be confrontational, like the first clinic visit,
Mm.
how long do I have left? I think I'll be like that if it's me.
Yeah, tell me how many more
Yeah, tell me how
days
many more
or
weeks.
weeks or months.
Yeah. That kind of thing. Because you want to plan and all these kind of things.
Yeah,
But
yeah.
for my dad, he never ever asked. Even when um every scan, it would show that
Mm.
it maps to his lungs, it maps to his liver, to his peritoneum, blah blah blah. He never asked the doctor, and
Mm.
I think the doctor understood. And she also didn't like encourage him to know and all these things.
I guess that earlier on we mentioned, Paula, is we also got to go in sync with the patient's readiness and
Correct.
willingness. No need to
Correct.
force it down their throat if they don't want to know. Right?
Mm, mm.
Does it
And
help your dad not to know?
I think it did, because in a way, he wasn't bogged down with the date, the expiration date. And I think
Mm.
I feel like he wasn't really thinking of himself. I
Mm.
feel like he was thinking of the family. If there's a timeline or there's a deadline, the family might feel like, I don't know. I don't know what was going through his mind, but to me it really helped him, especially my mom, not to have
Mm.
this kind of thing. But I mean, it depends on the patient. Like what I
Mm.
said, for me, I would prefer to know. For my
Mm.
dad, maybe he was thinking of the family, or maybe because he was so like him and my mom, they were so um they kept praying for a miracle, as Christians, that that was a very important part of the journey to my family. And I mean, who are we? If your patient, if you know that your patient's prognosis, they're gonna die in the next 2 weeks, but the patient still has hope,
Right.
who are we to take that hope away from them?
Exactly.
So so on this note, I'm gonna share what went through those last few weeks. So he was still very he was work from home and everything. And then what happened was, just one day in August, we had, the night before actually, we were still singing karaoke at home. He was just feeling his usual abdominal pain, but nothing else. And then the next day we rushed him to the hospital. Very long story, but basically septic shock.
Okay.
And so
Rush to the
he's in the
hospital. He's having
ICU.
fever, or what
Yes,
happened?
he suddenly had 40-degree fever. He didn't have the night before. The next morning had 40-degree fever.
So
I
there's
told
sudden turn
him,
of event.
correct. And as nurses, we all know that, sepsis is such a silent killer.
Exactly.
Septic shock can occur in literally minutes. So
So
even
usually we
even
learn, Paula, can I just ask a question? Like we learn in the APN teachings lesson that, sepsis can come from the devices, can come from
mm,
the
mm.
surgery. So in your dad's case, is that devices that he has?
So he actually, APN Chuching talked about this in the very last lecture. So what she
Exactly.
said was, the stent, so they had to open up his bile duct. So they put in a stent there. And with all these procedures, there's always a risk of infection, post surgery
Exactly. I
infection.
see.
So the stent got blocked
Okay.
because of all the, his liver wasn't working well already because of all the
Mm-hmm.
tumors there. So
Mm-hmm.
there was some like sediments, and then the stent got blocked, and that's what caused the sepsis,
Sepsis.
and
Okay.
and
And
then
then,
eventually septic shock. Yeah.
okay. So he
So
had a fever, high fever.
mm,
Any other
high
symptom
fever.
he has?
He had high fever. It disappeared within an hour, I think. I told him to actually, let's go to the doctor. Let's go to the hospital now, A&E now. But he didn't want, because he had a Zoom session at 4 p.m., like a Zoom meeting at home. I mean, for work.
He's still thinking
Yeah,
about work at that in
he's
that
still thinking.
condition.
Correct.
Wow.
He's still thinking about work. So I was like, okay, after your meeting, maybe that was a mistake on my part. I don't know, cause um he was insistent. He really did not want to go to A&E, and he said he felt fine, and the fever disappeared. So observation, very important. If there's something that you are not comfortable with as a nurse, just escalate. Just escalate, because you never know what would happen. So um we long story short, we rushed him to the hospital before his meeting, because he was breathless already, and diaphoretic and stuff. So he spent 5 days in the ICU, but then eventually went back to the normal ward. So they cleared the infection in his blood, but they couldn't clear the infection in his liver. And they used a lot of like intense drugs already. Some drugs are very new, like haven't even been used before, because the bacteria are so resistant. And then, just I think 1 week after he was transferred back to the normal ward, his oncologist took me aside. So, and then she said that, Paula, I think it's time to talk to your dad um about his final wishes. Just when he had the liver surgery, the stent insertion, I actually asked his oncologist already, how long does my dad still have? So we had an understanding lah, so between the two of us.
Can I ask
And
one more question, Paula?
yep.
It's like at any point, did anyone explore uh, advanced care planning with your dad? Like, how is the multidisciplinary team like for your dad? Is there, because APN teaching talk about
mm,
the need to refer patient for various kind
mm,
of
mm,
support, like even pastoral care. Can you share a
mm.
bit, like any kind of support that your dad received?
So I think this kind of thing would really depend on the patient, the family dynamics, and all this kind of thing. For my dad, um I don't know if it's because it's a private hospital, or I think it's also a large part is because of my family dynamics. They know that I'm already a nurse. so like that part is taken care of. For medical social worker, we didn't need one because my dad, thankfully, he was under insurance. We didn't have to pay a single thing from the start of his treatment, from diagnosis to the
You
end.
mentioned earlier, I think your dad bought him himself the integrated plan insurance, right?
Yes,
Thank
he
God.
bought actually just I think a few months before he was diagnosed, and he bought it.
He doesn't know
Didn't
that
know.
his health
He
is,
didn't
is
know.
affected. He doesn't know.
He
It's
bought it
God's
out of
plan,
goodwill.
right?
Yes, it really is God's plan. He bought it out of goodwill because the agent was actually a family friend from the, as in we didn't know him. He's like a friend of a family friend from the Philippines. He's
Okay,
starting out in
right.
Singapore and all that. So he was just like, okay lah, let's buy from him. Poor thing. Like no, don't know anybody in Singapore. He bought for all of us, and lo and behold, like I think just 3 months later, he got diagnosed.
Wow.
And like one sitting for his chemo session is like thousands of dollars because
Right,
it's a private hospital,
right.
and all his surgeries and things like that. We didn't have to pay a single cent.
Wow.
His last hospitalization stay was 300K and we didn't
Wow.
have to pay a single
Yeah,
cent.
it's actually oncology treatment is very expensive
It's very
generally.
expensive. It's very
Yes.
expensive.
So the
And
financial aspect is something very, very uh crucial. Financial counseling and
mm,
looking for ways to support the patient through the treatment.
mm, mm, mm. And sometimes actually the patient may not spontaneously let you know that there's a problem with finance. So what I appreciated also with the doctor or the nurses, like it depends in depends on the clinic and who's talking to you, is they asked us if there's any like financial concerns and all this kind of thing, even though I mean they already know that it's a private hospital, you know
Right.
they would maybe, like usually they would think maybe it's not a problem, but they asked us out of goodwill, and thankfully we have insurance. But
Mm.
even without the integrated shield plan, we are very well covered by the government, medisave,
Okay.
medishield life, and all that kind of thing. So nurses, let's read up on all those different subsidies.
Yeah, that's why we always say that please think about discharge planning. Please
Correct.
think about the financial aspect because we are the one that's closest to the patient. We are probably the one that's able to pick up about such challenges in their life more than anyone else.
Mm,
And I
mm,
know, Paula, being Asian, uh,
mm,
we tend to we have to accept the fact that to us it's so hard to talk about asking for help.
it's
You
like
know,
save face,
yeah, save face. Like I was part of my PhD study, I could interview patients, and when they have financial difficulty, they'll say things like, no, they want to have the dignity to
Correct.
say that I
Yeah.
want to be able to provide for myself, and if I have no money, I'd rather not have any treatment. Right.
mm, mm.
So that part, I think, as nurses, we got to learn to how to reach out and how to
Correct.
see in what way we can help support them, refer them to MSW. And
Mm,
it's not about saving face; it's about saving your health and your life and all that. But we
correct,
have to do it
correct,
out of respect. Yeah, right. Like
correct.
not forcing it upon them, but trying to understand them, empathize with them, and then provide them with education so that they can be enlightened.
Yeah. I think as nurses in this disciplinary team, we
Mm.
play a we play the role of a glue. We are the
Mm.
one that holds the whole kind of holds the whole
Yeah,
team
yeah,
together,
exactly. Yeah.
because we are the jack of all trades. We don't specialize in the finance, the OTPT and all these kind of
Yeah,
things,
yeah,
but we
yeah.
are the ones who see it first from the
Yeah,
patient. We identify
exactly.
their needs.
Yes,
Yeah.
yes. Yeah.
So it's very important. Assessment is very important. Observation is very
Mm,
important.
mm.
And then
Taking appropriate
talking
action.
to correct, taking
Yes,
appropriate
taking appropriate
action,
action and then
when to
evaluate, right?
escalate.
Yeah.
Correct. APIE.
APIE,
I love
yes.
APIE. APIE.
PPMP
Yeah.
one start APIE. So towards the end, your dad don't really ask about his prognosis. What
Mm,
how does he have the closure? You're the one closest to him, Paula. How
mm,
does your dad have a closure? Because you know, when every one of us have to come face to face with death, we want
mm,
a closure.
mm.
How does your dad have that closure?
Yep. So what happened was that the doctor spoke to me, and that the death talk didn't really come from the doctor. The doctor told me, knowing you and your family, it's not that I'm putting the burden on you. It's just that I feel like you're the best person to let your dad know, and all. And she's right. She's actually right. As healthcare professionals, we have to know, as nurses, we have to know um the family dynamics well enough such that you know who to tell it to.
Right.
Because if the doctor told my dad, he might not have taken it as well as he did when it came from somebody familiar in the language that he preferred. So language is important also, in
Right.
a way that he preferred, you know. So when the doctor told me that, I was like, okay. Then I asked her prognosis and all that. She said maybe like a few weeks to several weeks, blah blah blah. Um, so I sat my dad down. I was in the hospital 24/7 in that hospitalization. Yeah, he was hospitalized in August, start of August. Around middle of August, that's when the doctor told me. And then your choice of words is very important also when you are faced with this thing. So somebody asked APN teaching in the previous lecture, like, how do you tell a patient that he's gonna die, or a dire prognosis or something? I feel like, number one, you really have to understand your patient,
Yeah.
know how to um either explain at their level of expertise. If you're talking to a doctor, of course, it's different. If you're talking to like a super layman, it's different. Secondly is um I ask what they know. Yeah, I think I've covered this before. So, and the choice of words is very important. That's the last thing. So what I told my dad was, instead of taking the hope away from him by saying that, you know, you're gonna die, that kind of thing. That's not the way to go. What I told him was, D, I don't think we have a very long time left. So always use the pronoun we. Like don't use like you, or because we it gives the patient a sense of belonging, like you are with them.
Yeah,
So
we're together
always
together. Yeah, we're
correct,
going through
correct.
this together. You're not going to go through
Mm,
this alone,
mm,
right? Yeah,
mm. So you can
that's
see
a
even
good
in
point.
hospitals, those doctors, those nurses who are very, very good with patients, they always use the word we. And then they always use the patient's name as well. So they will touch the patient and they'll be like, hey, blah blah, that kind of thing. So that's what the doctors and nurses did with my dad as well. So I told him that we don't have a very long time left, and we have to shift our support. That's the phrasing that I used. Instead of focusing on like treatment and really trying to get better and stuff, we need to shift our support so that when um when the time comes, we are more ready. And then the oncologist also brought in a palliative doctor. And this is one thing that I will not forget that he said. So um when he first came in, my mom and my dad still had a lot of hope. They still really wanted him to get healed and stuff. So instead of the doctor trying to make them understand that, no, we have to go through palliative already, blah blah, what he said was, um okay, since that's what you feel, let's get your body ready, so that when your body is ready for healing, at least your mind, your body will be physically ready for it. So I think that's a very tactful way to say it, without taking their hope away from them, because hope is still very important.
Yes, yes, yes.
But my dad did tell me that, when I first sat down with him, my dad did tell me that he could feel it, and that he was ready because he knew where he was going. So that's the number one thing. He knew, he was like, I know where I'm going, I'm ready. I don't know if he said that just to make me feel better, because I was also like on the verge of tears then. And I never cry with my dad because I wanted to be like the strong one in the family. Yeah,
Wow.
but he knew, he told me that he knew. So spiritual direction is very important for the patient. And I think as nurses, we live in such a multiracial, multi-religious society. we have to be sensitive to their beliefs.
Yeah, yeah.
If yeah, so set aside what you believe in, and then just focus. Like for example, for me, um, if my dad still chose to pray for healing, for a miracle instead of like peace and calmness for his passing, who am I to take that away from him if that's what he really wanted?
Exactly. Yeah.
Yeah, so it's very important to address that side also, the spiritual part
Mm.
of nursing. Yeah.
Yeah, yeah. Uh, to sing along with the patient and to support them. Yeah.
Mm, mm,
Wow, must be really difficult for you, Paula. How did you
mm,
stay strong as a caregiver for your dad?
mm. I think to me, my autopilot like nursing persona kicked in, especially at those last few weeks, because my dad really wanted to go home. He wanted to, I mean, he wanted to go home because he wanted to get better at home.
Mm.
To me, that means palliative care at home for the last few days or few weeks.
Mm.
So I set up like a mini home hospital for him. And as a nurse, because I was looking at myself as a nurse then,
Mm.
it wasn't difficult for me because
Right.
I was in the I was in a place where I was comfortable, you know, like
Mm.
wards and healthcare and all these kind of things. But as a caregiver, no, I have this one friend, I cannot forget what she told me. She was like, amidst all this, don't forget that you're a daughter first, and then you're a nursing student or you're a nurse. So, I mean, when I was doing all the logistics and stuff, I set aside me being a daughter because I wanted to get it open. As in, I wanted to finish things. And if I worked as a daughter, it's very difficult for me to function because of the emotional part of it.
Mm. Mm.
But I did based because my friend told me that, and it just hit me profoundly.
Mm.
So I made time at night when I would, because I was still having school in August to September. At night when I was revising or like doing my pre-tutorial work, I would just sit down, look at him, and then like in my head talk to him. Yeah, yeah, and process through the emotions. I think as a caregiver, it's very important to give yourself some time to breathe, not just to
Mm.
breathe, but to process through the emotions. Because during the day, you know, the hospital is so happening, you may not have time to process through. And
Mm.
as nurses, it's also very important to look out. You're not just nursing the patient, you're also nursing the relatives as well. So I
Mm.
cannot remember this one nice nurse who she's quite old already. And then she was just like she, I guess she didn't really know how to ask me all the emotional questions, but she always, because she's always night shift, she always asks me, hey, are you okay, do you want some Milo? Like, you know, asking the asking the relative if the relative wants Milo. That's like, wow. Yeah, so she said, do you want Milo, you're always
Simple
studying so
gesture
late at
like this that
night.
touch you, huh, Paula? It's like
Correct,
simple
correct,
gesture that can move your heart, right?
correct,
Yeah,
correct. So
especially when you're
it's
so
these simple
tired.
gestures. Yeah, I was
Mm.
like, thank you, but oh no, thanks. I'm on a diet, but thank yeah, thank you. So I really appreciate it. And I remember her face, I remember her name because of this
Um,
simple gesture. And there were also times where at night, one usually the night nurses, like, because that's the only time that it's peace and quiet. Then
mm.
they asked me, hey, how are you?
Mm.
You're always studying till 2, 3 in the morning. Then you get woken up by the beeping of the all the IV drips and stuff like that. So
Right.
it's it just warms my heart. Yeah,
Mm.
even though they know that I'm a nursing student, it warms my heart that they still take the effort to ask me how I am. Because I
Mm.
feel like no matter how put together the person looks like, the caregiver looks like, there's of course still that fear, anxiety in
Mm.
them. Speaking
Mm.
from experience,
Right.
yeah, yeah. So it's very important. There were also
Mm.
some nurses who maybe they don't know how to approach. Whenever they walk in, they'll just give medicine and
Mm.
all. I remember their names and faces also, not because of the gestures, not because like I told myself that's not who I want to be.
Oh,
Yeah, so it's very important to be mindful of your actions. Don't be
right.
afraid to just make small talk.
Yeah.
Even you don't need to be the counselor for the patient,
Of
but
course.
don't be
Is
afraid.
to not to take your work being task orientated. It's like,
Correct.
okay, I need to do this at this time, and I need to finish this work by this time. That we forget that, hey, we are dealing with human beings, right? Yeah, we're just being
Correct.
human, to be able to
Mm,
empathize, to be able to support, to be able to touch and to comfort with good, encouraging words,
mm,
to help patient feel better, right? Yeah. I
mm,
think that's the beauty about nursing is we are in a very privileged position.
mm, mm.
And Paula, what your friends say, I think is also very true. Is like being a daughter to your dad is like how so now you got to take off your nursing cap and put on the
Yeah.
daughter's cap. And how did you reconcile your role as a nurse and as a daughter as you process this last part of your dad's journey?
Mm. Maybe this was more of because I was very busy in the hospital. So I held on tight to my nursing hat. I didn't want to let go of it. But when we finally brought him home, we brought him home on a Sunday.
Mm,
Um, that's when I got a lot more relaxed because you're not in the hospital environment anymore.
mm, mm,
Even though I do have the hospital bed, oxygen concentrator, and everything there, and it
mm.
looked like a mini ward, but
Wow.
yeah, it looked like a mini ward, but the home environment just gave a different vibe to it.
Mm,
And
mm,
I mean, even though I was still giving him drugs, injections, and all this, um we could, like, I was able to play the daughter's role by praying for him, praying
mm,
together with the family. So the
mm.
pastor actually visited on Tuesday.
Right.
Yeah, and that's when, she prayed for peace, comfort, through this last few, just left it hanging few something.
Mm,
Yeah, because we don't know if it's a few weeks, a few days. Yeah, and all that. So after the pastor visited, then I think that's when I didn't take out the hat completely, but that's when I was much more comfortable with just being a daughter at that point
mm,
of time, being there with him. So what I told myself was I didn't want, when my dad passes, I didn't want my to remember myself as just giving drugs, giving injections. I also want to
mm,
remember myself as how I'm remembering my mom, always talking to him, encouraging him, sitting by his bed and like
mm,
yeah,
mm,
telling him stories and all that kind of thing. So when the pastor visited and she finally prayed for that peace, my family, we sat around my dad and we we actually had our last talk, so to say. So we, my siblings and I, we thanked him for everything that he's done for for the family. So especially for me, I was telling him that even like this last few days, you're still teaching me instead of like he couldn't really talk at that point of time already, so he was just absorbing. Then we'd ask him, can you hear us? Can you raise your eyebrow? If you can hear us, then he'll raise he'll raise like that. Yeah. And I think that was the part where I really felt like I was a daughter already. I apologized for all the things, that specific things, like two specific instances where I felt like I really disrespected him as a father. So on Instagram and whenever I share, I always come across as like, wow, she's such a good
pardon me.
daughter. That was yeah. He always, yeah, I always, like, people say, wow, you're such a good daughter. You're so strong for your dad. You did so much for him, for your family. But what they didn't see was also the times that I wasn't very good. Maybe because of caregiver fatigue, because of stress, and caregiver fatigue is very real. There were times where I really was really quite disrespectful. So I said sorry for those times. And then I was like, can you hear me? Like, I was shaking. Can you hear me? Can you say that you heard me so that I can be at peace that. Then he said yes. He didn't say yes, but he nodded and he raised his eyebrows. And then we'd ask him, like sometimes during the day, in between when I'm giving him injections and all, or like handling his spot a cat or whatever, then I'll be like, I'll whisper to him. I was like, D, do you love me? Then he will open his eyes a bit. Then he'll be like, yeah. So it's those moments. It's really those moments. And I also apologize because he's very 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 showy with his love physically. So he'll always tell me, Paula, come here, kiss me, hug me, thing at home. And then I mean,
Still like
I'm
his
not.
little girl,
Yeah,
right?
correct. And he always only does it to me because he like to annoy me because I always get annoyed very often. So I'll be like, no, no. even in those like 2.5 years, I'll be like, no. But sometimes of course I'll give him a hug and all. And then yeah, in those last moments, I was like, D, I'm hugging you now, I'm kissing you and all that. I mean, at that point of time, he was quite unresponsive already. We brought him home on a Sunday. He passed on a Friday.
Hmm.
Yeah, so I think we had that closure,
Yes.
so to say. It's very
You have a picture
important.
of that, right?
Do I? Let me see.
I think you have a. I think I saw it just now in one of yours. Yeah, you scroll further down.
Eh, don't have a. I have
Last picture,
because
the last picture.
the last picture was his. Okay, I'll show you. Where is my okay? This one is it?
Oh yeah, this one. Yeah,
Yeah,
I saw
this
that picture.
one.
He looks good. Yeah.
I don't think I have other. We
What is
didn't.
this? This is at Mandai already or what?
Yes, this is at Mandai crematorium. So we cremated him. He really wanted to be cremated. I asked him, "Do you want to donate your body to NUS?" I asked him. I asked him in 2019, I think, when we were learning about organ donation, we have a
Tira.
module. Yeah, correct. And Tira. So he was like, maybe they won't take me because I have cancer and all. But anyway,
Oh,
he told me he was willing, but I didn't push it because like the rest of my family members, as in my mom especially, didn't really want to.
um,
Although my sister and I are both body donors, but yeah.
um,
So we printed this photo of him because we wanted people to remember that
hmm.
what a joyful spirit he
Oh
was. Yeah,
yeah,
I
yeah,
think
that's
that's
right.
also what he wanted to be remembered as.
Yeah, that's right.
Yeah.
Wow, what a
And
beautiful closure, Paula.
yeah.
Yeah. And thank you so much for sharing your journey with us as a caregiver. You know, we a lot of times we know the theories by head, but nursing patient is not just have theory in the head, but also to have the heart and the touch as well. And in
Correct.
order to be able to touch the patient, connect with patient, it's really great to be able to hear firsthand from you as a caregiver how you journey through with your dad and all the ups and downs and all the challenges. You know, patient have their cancer fatigue, but you as a caregiver also had a caregiver fatigue and stress as well, right? And how you got to juggle your role as a as a nurse and as a caregiver. Yeah, and I believe for all your peers who are taking this module, nursing practice part is applying your theory to practice. I hope uh, and I pray that all your peers who are going out there for their clinical attachment and eventually graduate to be a registered nurse would really remember that to be a nurse is such a privilege and it's such a beautiful profession and something that we all should hold our head high and be proud of. Yeah,
Exactly.
and to continue to
Exactly.
touch lives, right?
Correct.
Wow, Paula, I can't give you a big hug now, but virtual hug. And thank you so
Virtual
much
hug.
for being such a strong, filial, wonderful, competent, compassionate, um, best daughter for your dad.
Thank you.
Yeah.
Thank you, Dr. Siriwan.
And yeah, I shall post this in Luminous so that all our nursing students can hear your story as well. Love
Post it on
you.
Nurse 6 as well. Thank you,
Yes.
Dr. Siriwan. I really
You're
appreciate
most
it.
welcome. Take care.
Thank you.
I'm lost for words now, and I better don't get emotional again.
we
But
can
thank you,
stop the
Paula. I
recording
really
and get
love you.
emotional again. Thank you, Dr. Siriwan. I love you all too. Thank you for this
Yeah,
opportunity. Thank you. Thank
you're
you.
most welcome. Thank you for your time, Paula. Thank you for sharing your journey.
Thank you. Bye,
I'll stop
everyone.
recording now.